How did we get here?
What are you seeing behind those closed doors that we don't see?
There's a reason why physicians commit suicide. It's just not what we're trained to talk about.
What needs to be fixed?
Give the antibiotic, give the Percocet, give the Xanax. What chance do our kids have? That's what primary care is in the United States. Mission impossible.
So why is this message not out there?
Well, there's money. Why do we prescribe more oxycodone in this country than any other country in the world?
I'm an addictive personality, so it's either all in or nothing.
So I love my patients, but I can't do everything.
I mean, that's just pure crack cocaine for kids.
It's cost effective, and there's fewer side effects, and it's cheap, and it's available to everyone. If people don't know, they should know.
Beautiful day. Good morning, guys. Here with Anthony Kaveh. He's an anesthesiologist here in the San Francisco Bay Area, and you're also a
Integrative medicine specialist.
Integrative medicine medical specialist. So today, guys, we're going to talk about the medical world, and I've seemed to find there's a big gap between us citizens and what's going on behind the closed doors in hospitals. So we're going to talk about, let's say, some of the disconnect, some of the challenges, some of the things that aren't going so well at the moment.
I can't think of anything.
Brave Anthony's here with us to do so, but it's not all doom and gloom. We're going to talk about some of the ways all of us, you, me, Anthony seems to have it figured out so far, but how we can implement things in our lives to make them much better during these COVID times and just life in general. So Anthony, what's the biggest problem you're seeing right now? That's a wide question, but what are you seeing behind those closed doors that we don't see? And as an anesthesiologist, you're seeing people on the line of life and death, right?
Every day we see people right on the line, and yet our society has been looking a lot like a penny wise, pound foolish kind of story.
Okay. What do you mean by that?
So imagine trying to save a couple pennies here and there, but then in the long run losing pounds and pounds and pounds. Or we look at, for example, masks right now.
Right.
We recognize there's a very real benefit to masks in the correct situation, and we recognize that the risk of transmission in situations can be very low. We focus on the things that might save pennies, like masks in outdoor settings where the risk for transmission is low, but we're unfortunately very mute about the pound.
Okay.
About what are the underlying risk factors that increase the risk for severe COVID infection, for example.
Okay. So why do you think there's no attention on these overall factors? These, you know, there's sort of some big themes here, but like overall health and society is going to better society, right? Why is there a lack of attention on that?
A healthy society is good for you, it's good for me, it's good for every single person, because we're all invested in the healthcare system. If someone can't pay for it, you and I have to pay for it at the end of the day.
Right.
And money's a finite resource people forget. If somebody is using too much of it, unfortunately, that might mean less for somebody else.
What are you seeing, Anthony, when people are on that line, you know, between death, life and death, you're that guy holding them there, which has got to have a lot of stress and obviously responsibility. What are you seeing in the health of society, or what can we learn from that? I'll let you take that one.
How did we get here?
How did we get here?
How did we get here? Something that people need to recognize is that in the operating room, in the emergency room, in acute medical settings, we do a phenomenal job with Western medicine.
Okay.
We save lives. When you get hit by a car on the highway, if you're unfortunate to have a gunshot wound, you have a bad accident, we will do the best job with our cutting edge medical devices and all those things, undoubtedly.
Sure.
But this is the minority of what costs us as a society, and what costs us as a medical care system. The heartache, essentially. We see the sick people out there, and it's rarely from these types of acute conditions. It's usually from the consequences of high blood pressure, from poor nutrition, from obesity, from diabetes. When people get their amputations from their diabetes, when they don't have eyesight from their diabetes, when their kidneys fail. This is what constitutes a lot of what we see. And when they end up on the OR table because they need their limb amputated, or they have an aortic aneurysm because they've been smoking their whole life. How did we get here? What happened for the years and decades we had to intervene to help prevent this from happening? It breaks my heart.
Hot dogs in schools aren't helping for kids?
Well, I mean, maybe the Doritos help sometimes. I don't know. But I don't know if I can say brand names like that. But yeah, the vending machines to the kids, the targeted advertising of unhealthy habits to our children,
right,
does not help.
So what do you think? You're in the medical world. The reason these things are not being talked about at a, there's not a lot of volume on this topic is because where's the money to be made? It's not on prevention. I'm going to throw you under the bus a little.
Oh boy.
Say whatever you want, obviously, but it's not prevention, right?
Yeah, unfortunately, an ounce of prevention is a pound of treatment. But we're disincentivized. It's the plain, unfortunate truth. And if people don't know, they should know.
You're disincentivized as a medical worker, as a hospital, what?
Well,
pharmaceutical company?
Dude, you're
typically
famous.
Now you are.
Awesome. Yay! Thank you for great work you're doing.
Thank you.
Great work.
You're a very health conscious individual.
I am.
I can tell.
I am. I'm jealous of you. I want to be doing what you're doing.
Oh. Do it. Grab a GoPro.
This guy's a serious YouTube.
Anything we do, there's always a risk and benefit. Anytime someone's having surgery, for example, yes, you might take out the appendix and they might be just fine. They probably will be fine, but they could also die on the operating table from complications of anesthesia. They could die from an infection.
Right. Can I tell you one of the experiences I had in the medical world?
Go for it.
And I've been to the doctors very, very few times. I've had very
Good
few
for you.
injuries, luckily.
Good for you.
So I was on a mountain. I was mountain biking. Crashed the bike, broke my finger. Got splinted up, healed up fine. A few weeks later, I was getting this tingling down my arm when I was sleeping. And so I went to the doctor and I said, Doc, I'm getting some of this tingling. Is there anything I can do? And he did this. Do you mind?
Go for it.
He's like, see, Peter, what we'll do is we'll just take out this top rib here. So we remove this, it will free, I forget how he said it, but like the nerves will become unpinched, blah, blah, blah. We just gotta remove that part.
Yeah.
And I felt like I was talking to an auto mechanic about my suspension not working. And I said, Doc, what about yoga or acupuncture? Is there anything else I could do? I'd rather not start dismantling my body over some tingling at night.
Yeah.
And he assured me, no, that won't work. Not gonna happen. And I didn't follow his advice, thank God. 2
You
weeks.
still have all your ribs in place?
I still have all my ribs. 2 weeks later, it went away.
Went away.
And I haven't felt it since.
We call this the tincture of time in medicine. Tincture of time.
God, it's got a saying.
Oh, of course, because this is what you just said. Things are on a spectrum, and the body has an incredible potential to heal itself. Undoubtedly.
Okay.
Nobody makes money when the body heals itself. We need to face it.
So he's making a sale.
I do want to be careful. I wasn't there. I don't want to speak for the surgeon. I don't know what your symptoms were. But traditionally, the truth is that when we go to medical school in the United States, we are trained to deal with acute situations, which we do very, very well.
Right.
We are not trained for wellness. We're not trained for health optimization. We are typically not trained for low risk interventions.
So who is trained for that, and who is, giving us that information in society? It's not the CDC, right? We're not having our big organizations telling us how to live. I mean, I'm sure there's stuff on their websites, but I don't feel like there's some, especially this year, you think there'd be like, okay, the best thing you can do for yourself is get in a really good health. I've failed on that a little bit this year. I've doubled down on my chocolate intake. I've doubled down.
Go for the dark chocolate, 100%.
I'm not a purist like you. There's not as much dopamine in it because let's face it, shit food gives you a rush, right?
But did you know that you can retrain your body? Did you know that the dopamine rush can be trained? No, we don't talk about it.
Let's go over here. Let's check this out.
The palate adjusts. The palate adjusts.
I don't know. That's a big sale, Anthony. How does my palate adjust from the nice? Because sugar is the dopamine. It's the quick hit.
It is, but there's more than just sugar that can do it. But see, that once again, there's no. What incentive does anyone have to try to explain to you how your lifestyle can fundamentally change your physiology? It's just not what we're trained to talk about, because And it's not the fault of doctors. We have 15 minutes maybe with a patient, maybe 20, 30 minutes for a first time encounter.
You guys are pressured hard these days, right?
We are pressured hard. It's not a sob story, it's the reality.
Right.
We have very limited timing because do you want to be late for your appointment?
No.
I mean, sorry, you don't want the doctor to be late to see you, right?
Right.
Well, then if you can't take extra time with your doctor and have the next patient be late, right? I mean, it wouldn't be fair. So
Right.
we need to be on a timetable
Yep.
to keep everyone happy. It's really mission impossible. That's what primary care is in the United States. Mission impossible. They ask way too much from primary care docs, and there's no way they can deliver. Who's going to sit down with you for an hour to talk about how your body can heal itself? Who is going to sit down and do that?
Right.
We're not trained. We don't make money because we don't get compensated as much for preventive things as we do for acute fixes.
Okay.
And I'm not going to comment on the right or wrong insofar as to say that you can tell me if you would rather have somebody spend an hour talking with you about your lifestyle
Right.
and how you can prevent it versus being on the OR table 20 years later because your coronary arteries are filled with junk from the lifestyle that led up to that.
Okay, what percentage of your patients are there because of bad choices in life?
Recognizing that we don't have the absolute truth number,
Yeah.
it's probably going to be well over 50%, probably in the 75% line.
Okay.
But it depends on many factors, and I got to say this to be complete here. There are going to be some cancer centers that look at only specialty care in pediatrics. The child with a glioblastoma in the brain, it's very difficult to say what led to that.
Yeah, sure.
The
Gotcha.
child who's got a tumor in their eyeball, difficult to say that it was a lifestyle choice.
Yeah.
Versus the older woman with uterine cancer with risk factors that we know revolve from elevated BMI and obesity. For example.
Gotcha. So what do you want people to know? You reached out, you said there's sort of an information gap these days in your industry. I hate to call it an industry, but that's what it's called, right?
Well,
it's an
is.
industry?
It is.
Okay. There's an information gap between the public and your industry. I mean, in a nutshell, these are all like 5-hour-long conversations we could have every one of these topics. But what needs to be fixed in this sense? Like, what would be some remedy, quick fixes? I hate to say that. I don't want to say Band-Aids. We need deep dives, right?
We need deep dives.
Structural deep dives.
But it starts, yes, at the organizational level in terms of community structure and public health. Of course, this is going to be the bedrock. It's unequivocal how important this is. But
Right.
there is also personal responsibility and agency. And this is the beauty, the elegance of the human body. It can heal itself with the right empowerment. And to answer your question of what is the single most important thing is patient empowerment. Everybody can heal themselves to an extent, but their environment may not enable them to do so, which is why it's a two-pronged approach. Of course, the community and the environment has to be optimized, but we can never forget that the patient themselves has incredible potential to heal their body.
How is that approach now? It's approach that the patient doesn't have incredible control over their destiny. Or what do you think on that?
No, absolutely, you're correct, because the message is that you see commercials for antidepressant medications, for erectile dysfunction medications, instead of addressing the underlying cause. What we forget is that all these drugs that are pushed out there have side effects. This is why what I said earlier, in Western medical approaches, we unfortunately forget the risk-benefit of every recommendation we make.
Okay.
Everything as benign as any medication may have potential, tremendous potential for benefit, but also has potential for problems.
Right.
And this is the opposite of patient empowerment, where we look at lifestyle, where you nearly unanimously have tremendous potential for benefit without the side effects and with less cost. When we look at 20% of GDP going to healthcare costs, the lifestyle modification components don't contribute to the 20% number that we're talking about.
Right. Oh, let's go up here. Here we are in Golden Gate Park, guys. Such a beautiful park in San Francisco. Okay, so there's a lot we can do on an individual level, but it's hard. I'm not in my optimum shape right now. I've been in much better shape before.
Why do you stay in prison when the doors are wide open? We know a lot of I don't know. How?
No, it's good. How?
is hard.
How do you do it? It's
Yeah.
nice. It sounds good,
Yeah,
Anthony.
yeah.
Like I'm empowered, but I'm also empowered right now. I have a craving to go get that, that cookie after this
Yeah.
talk, right? So you're empowered. Yes. Okay. But give me a little more on that. Like you're a strong-willed guy,
Yeah.
and you're seeing it. I guess you have an advantage too. You're seeing every day at work the fallout from bad habits.
We all are, but yeah.
No, you more so. People are.
Anybody who's sending a check to the IRS who knows that what their tax
Yeah,
burden
but
is.
there's a disconnect. There's
Yeah.
a disconnect.
No, you're right.
You're not connected. You're not up
I'm
close
tongue in
and
cheek a
personal.
little bit, but yeah.
You're in those hospitals. You're seeing people dealing with type 2 diabetes, which you just scared me about because that comes from eating too much sugar, right?
Multifactorial, but yes, lifestyle and refined sugars
Yeah.
are one of the strong contributors we believe to developing, and particularly in children. And when children develop type 2 diabetes, it's the worst case scenario for us all
Yeah.
because they have a whole
they're-
life ahead of them.
They're on the system their whole life. They're in the healthcare system.
And not to mention their own personal life loss. It breaks my heart. I was telling you the other day, I had a patient in the operating room, 12 years old,
Let's go down here.
who weighed over 200 pounds.
12?
12 years old.
200 pounds.
Over 200 pounds. And,
So what's his chances in life?
well, there's unfortunately a trajectory that is not fixed, but is likely. It's all about probabilities.
Okay.
And unfortunately, when that happens, that patient still has the potential to turn things around. The human body can recover, but it takes all the more willpower and acceptance of responsibility.
Okay. So is it fair to say that elements of the system look at that as a perfect patient because there's a lot of money that's going to be spent
Yeah.
on his life throughout his life if he
Well-
doesn't change?
You know, it's funny you say it that way because it's in some ways money to be gained from the treatment that comes from long-term insulin, from anti-diabetic medications that one may take, but it's also moral injury to the healthcare system because we're human beings. As doctors, it breaks our heart. It hurts. We don't want to see that child sick. We don't want to see their parents sick.
Right.
But what tools do we have when we're constrained in a system where we have 15 minutes with the child and their parent to talk about the lifestyle modifications? You ask, what do we do? Well, it starts with education. Empowerment starts with education and awareness. But it's difficult to give these tools to patients when the cards are stacked against them. The cards are stacked against us all in this type of...
Okay, one way to unpack, I would say, okay, easy food choice is fast food.
That's an easy example.
That's cards are stacked against you, right? And I was just in Southern California, and so commercial real estate, right? We all think in California, commercial real estate, or maybe across the nation, is in the gutter. Like downtown San Francisco, for lease signs everywhere, right?
Yeah.
Commercial properties. But I was talking to a commercial agent down there. I'm like, how's the industry thinking the answer is going to be terrible? He said, oh, my work is great right now. I'm like, whoa, how's that? He's like, fast food restaurants opening up left and right because of the pandemic, I guess, right? Because it's easy to go in and get takeout.
And yet, while masks have a role, the role is pennies compared to the pounds of that type of lifestyle nudging people.
Right.
I mean,
So, okay, how about this, Anthony? What the irony? Everyone has a mask on here outside as we're talking about pennies and pounds with masks. What's your take on that?
everyone has a choice to do what they want.
Okay.
And I will respect their choice. It is inconsistent, however, to place so much importance on a 0.01% risk versus a 1% risk. And the 1% or 10% risks come from an accumulated lifetime burden of fast food and unhealthy lifestyle choices that far overshadows the 0.01% risk. Recognizing there's a somewhat arbitrary numbers, but orders of magnitude difference.
Yep.
Versus what we saw, and comparing what we saw earlier to what most people are subjecting their bodies to on a daily basis. Wearing a mask can be it is very important in the right setting.
Give us the lowdown on that, please. I have my theories. Here's how I operate. Outside, if I'm not close to people, there's ventilation, UV light from all the doctors I've talked to. Outside, that risk is so low. They told me don't wear a mask. Around people, up close and personal, inside definitely, I wear a mask. Are you at liberty to say this, or is that too controversial from your...
That's a very reasonable approach. I carry a mask with me because I might run into somebody.
Yeah, and I have one with me.
We both have a mask on hand.
Yes.
When we're looking at the 0.01% risk, my personal risk profile is that I try to optimize everything, but even I don't believe that 0.01 or roughly with this, if you want to calculate it however you want, in an outdoor setting is very low.
Wait, it is very low.
It is low. It's undeniably low.
Yeah.
And there's realistically more things that are going to kill us than being in an outdoor setting, not wearing a mask, recognizing that we have a mask with us. Should the environment change? Because hey, we might go into a cafe right now, and that's a different risk.
So what this leads to also is what you're saying earlier is fear, right? And so if we're in this constant state of like on the heels instead of on the toes, worried, feeling in fear mode, in panic mode, that also hurts overall well-being and health, right?
It's risk benefit.
It's hard to measure that though. It's really hard to measure that.
Yes and no, because like we were saying earlier, everything is a risk benefit. Every decision we make in life has a risk and a benefit. The risks of fear and a continual state of concern and worry is actually not that difficult to quantify. We have heart rate variability measurements. We have galvanic skin response measurements.
Sure.
There's so many ways of quantifying the burden of persistent, unmitigated stress, elevated cortisol levels, etc., that have very negative impacts. And living in a state of fear, particularly in childhood, can result in long-term psychologic and physiologic problems.
And I've seen it in many ways, like being in the hoods. There's this people are worried about safety, and they're always on edge. When I was did this video in Miami, in the hoods of Miami, right? The guys I was with, really cool guys. But when they got in there, because we're on Miami Beach, they were chill. When we got in there, it's like their guard ramped up. If you're too relaxed, it's actually a danger for survival, meaning you're an easier target. So you have to have that fear mode up to exist, which has to be unhealthy, right?
It's unequivocal. This is not controversial. That living in a constant state of fear not only hurts your psychological well-being, but very much so your physiologic well-being. Undoubtedly, there's no question.
So why is this message not out there on a macro level, at least in the U.S. right now? I don't see it. I don't hear it. Why is there not an overall well-being approach?
You think there would be, because like we said, an ounce of prevention is a pound of treatment.
Right.
Yet we don't have that type of incentivized public health structure. Looking at the macro scale, we don't incentivize these things.
And in your training in med school?
So that the public health system doesn't do it as well as it could. It does a good job in many ways, and we're not downplaying it. It does a good job, but there's much more. There's always room for improvement. We're not bashing, always room for improvement. At the individual doctor level, it's partly not our responsibility the same way as it is a public health message, because we deal, like I said, we deal with acute people. We are trained to save lives. When someone collapses right here, we know how to do CPR, defibrillate, then we save lives in the moment very well. When we go past that, we drop off very quickly in our cost effectiveness of prevention and treatment. We can do it, but not cost effectively, because we have 15 minutes at a time. What are you going to do? A patient lives their 99% of their life at home, at their school, at their work, whatever. What is 15 minutes in the office realistically going to do other than manage some medications, try to talk about smoking cessation, trying to talk about lifestyle, and then got us to the next patient, because we don't want to get a bad Yelp review if we're late to see patients. Let's face it, we're under so much scrutiny. What are we going to do?
Is it getting harder in your industry?
Undoubtedly it's getting harder.
It's getting harder for doctors, what, in the last 5 years, 10 years?
It's been longer, but...
Well, you're young. You haven't been in it for 40 years.
But we unfortunately have social media that is escalating, and it's very difficult when we're trying to do what is right from our training, from the decades we spend in school, getting licensed, and then having people with perhaps less training and less education in our field trying to review us is a difficult situation to put us in.
Who's trying to review you?
Patients. And
Okay.
it's a little bit challenging
Yeah.
to try. Medicine is a little bit different than a random industry because the customer's always right. Is the typical business. The patient may come, and the common example, they want antibiotics. They
Yep.
want opioids for pain. I want my Tramadol, doc. I need my Percocet.
What, Tramadol? What's that?
Tramadol.
What's that?
It's a synthetic opioid. It's kind of like, it's a weak type of opioid, if you will.
Okay.
So people who want to, and this is very real, and these are the struggles that we have, because we cannot give out opioids liberally. We're an opioid epidemic because pain was viewed as the fifth vital sign. Many people will say because of industry influence that help doctors be more concerned and more receptive to prescribing opioids.